traffic update. In about 24 hours from now, another American medical missionary infected with the Ebola virus will be back on American soil in Georgia.
Dr. Kent Brantley, who is already here in the United States, will share the special isolation unit at the Atlanta facility with Nancy Wrightbull. Now, she, of course, is an aide who contracted the deadly virus while working alongside Dr. Brantley during their medical mission in Africa. Brantley entered the Atlanta hospital on Saturday, and his wife says he is improving. Now, part of the family's optimism comes from an experimental drug that Brantley was given before leaving Africa. So, of course, treating an infectious disease requires an army of highly trained medical personnel, as well as protective gear to keep staff and other patients safe.
A current example we're seeing with the CDC in Atlanta, along with Emory University. Meanwhile, here in Utah, news specialist Ann Forrester joins us live from Intermountain Medical Center with more on how they're preparing should something like this happen. Hi, Ann.
Hi, guys. So earlier we showed you the decontamination room. We walked you through the stages of that. Now, if a patient were to come through, they would be in a negative pressurized room. So, of course, we mentioned earlier, just as standard procedure, patients would be given a mask like this one for common symptoms, maybe coughing or sneezing. But for more serious cases, for suspicious cases, medical personnel need this protective gear. And joining us now is Jane Powers. She's a trauma nurse, and she's going to walk us through what medical professionals need to wear in order to protect themselves. So, Jane, go ahead and talk about this. It's a PAPR, right?
This is a PAPR. If a person would come in and would have suspicious symptoms such as travel and a fever, and we would want to give the staff additional protection, we would give them what is called a positive pressure mask, and this is what they would wear. It is a very dependable unit. It has a HEPA filter in it, and it lasts for 6 to 8 hours. And the hoods are worn with air that passes over their head and out here, so that none of the contaminated air or suspicious air from the patient could come back in and affect the person.
And we have Jason over here. He's dressed. He's ready to treat, a potential patient. So talk about what he's wearing.
Okay. So this is the isolation gear that a patient or that the personnel would wear for a patient that has a suspicious illness. They wear a gown and gloves. That's a standard procedure. And then this is the actual respiratory PAPR that they would wear. This is not a hazmat one. This is, again, for infectious disease. You'll see that the hose from the unit comes over here, blows the air over his head, and will come out here, and you can feel the pressure the air coming out here. This gives him comfortable protection. He can be wearing it for several hours, and allows them to wear their glasses, allows them to have facial hair. There are other types of protection called an N95 mask, which isn't as versatile as this. So this is the standard procedure. Matter of fact, we train people on their very first day how to wear these for their protection.
All right, Jane, thank you. So lots of precautions in place for medical personnel. And coming up in our next half hour, we're going to talk about some misconceptions that people may have about how diseases are spread. Back to you guys.
And Forrester reporting live from Intermountain Medical Center. Really important information to know for people that in case something like this were to happen, they're prepared.
Really interesting to see what equipment they wear.
Yeah, absolutely.
All right.